Good evening. Thank you so much for joining us on this episode of Family Matters. My name is Purity Museo. Now, when a couple begins a family, the expectations are they will start having children, and when this expectation is not met, then a lot of stress begin to creep into this family. Infertility can and has destroyed marriages. But does the fault lie with women only, or could there be a problem with men as well? Tonight on the show, we discuss about these issues. We tell you what infertility is, what are some of the causes, treatment options, and can it be prevented? Our expert tonight is Dr. Wanyoike Gichuhi, who is a fertility expert and is helping us with that conversation. Thank you so much, sir, for joining us, and welcome to Family Matters Show.
Thank you.
All right. And we are talking about something that is very common, especially among couples. But let's begin with what is normal. Tell us what happens before the baby is born.
What normally happens is fertility. Most of the time it will start by the age. It starts actually with menstruation occurring. At the age of 12, 13, most girls will end up getting menstruation, and that triggers that actually the ovary is developed and is capable of producing eggs. Initially in the teens, the periods may become irregular. The ovulation does not always occur, the egg does not always come. But by the age of 17, 18 then becomes regular, and therefore ovulation occurs. The same applies to the boys actually. At the age of 12, 13, then seminalysis, the formation of sperms, occurs such that conception can occur. It rarely occurs, but has been documented to occur as early as the age of 8, 9 years. And then the fertility will continue, and it will pick up in the early 20s for both couples. That's when they're very fertile. When at the age of 24, 26, that's when fertility is very, very good. And then when you reach the age of 35, fertility, especially in the female, it will start dropping down. And by the age of 40s, when you get 40, 41, 42, the drop is very significant. And by the age of 45, maybe only about 5% of the people will be able to conceive. So if there's regular sex, that's what you say, it's not automatic that if people have sex, pregnancy will occur. The probability is just about 25% in any particular menstrual cycle that actually pregnancy will occur. But with regular coitus, within 6 months, you'll find if people are staying together, 70% of the couples have gotten pregnant. And within 1 year, 90% are pregnant. And if the pregnancy does not occur with 1 year, especially that 10-15%, then we say actually they have a problem in conceiving. And by World Health Organization definition, is failure, infertility is described as failure to conceive after regular coitus for 1 year without any prevention prevention by family planning. Yeah.
You've started by explaining how age can alter the fertility of both. Is it only for female or male as well, the age?
Let me start by saying that getting a baby is a couple.
Yes.
It involves both man and the woman, and either of them can get affected. A man can get affected, female can get affected. When you go to the developed world, you find that actually man and female are affected with a 50-50%. In our setup, I'll say female are slightly predisposed, maybe about, I'll say 55 to 60%, and man 40%. Because of this high risk of getting pelvic inflammatory disease, tubal problems are more common among the Africans, and uterine fibroids. But it will affect both of them. But age actually affects the female, does not affect the man. Yeah. Again, however, when people get in the 50s, 60s, the libido may go down, and they may get actually lack of erection, what you call erectile dysfunction, that may occur again at in the 50s and the 60s in men.
So maybe is there an explanation why age is an issue when it comes to fertility? How does it affect the reproductive system, especially for a woman?
That's a very interesting question.
Yeah.
Brilliant. It's something which has puzzled people for the years, but the explanation is a lady is born with a specific number of eggs. By the time someone reaches the age of 12, 13 years, they have about 400,000 eggs. That's not a big number, because every month eggs will grow and they'll be lost. Every month you lose eggs. So eventually, as you get older, a lady gets fewer and fewer eggs, until when you get in the 40s, they're very, very few, and they're of very poor quality, and the eggs age. And that's why eventually the ladies on average at the age of 49, they get menopause. The periods disappear completely. But fertility will end up much earlier before the period disappear, almost 5-10 years. That's what you're saying. And that's why age is a factor in the female, because they are born with a specific number of eggs, and progressively they get less and less, and the quality gets poor until they get finished. With the man is different. Is the sperms are formed every month, every time the sperms are formed. That's why somebody even 70, 80 can be able to father a child, because the sperms form throughout their lifetime. That's the difference. Yeah. And can we prevent this progression of loss of eggs in the female? Can we stop it? No, we can't stop it. It will occur all the time. Even when somebody is family planning, there's still some eggs which will be lost. Even in pregnancy, some particular eggs will still be lost. So it is progressively loss of eggs, and we can't prevent it. And that's why it doesn't matter what you do. Most of the time in the late 40s, most people cannot be able to conceive at all. You may get ectopics, because sometimes you'll get somebody will tell you, oh, but I had somebody who conceived at the age of 51, 52. It's possible, but that's an outlier. That is not the norm. Yeah.
And does infertility only occurs when there are no eggs, or could there also be other problems, maybe in the reproductive system, say immature eggs, or even in the part of a man, maybe there could be a problem with the sperms? Maybe is there any other problem that can cause infertility apart from the age factor?
Yeah, that's quite important. Let's start with the man, because more in African it's been accustomed, when a couple cannot get children, they say the woman is to blame. No, men are affected. And as you have said before, almost 40-45% will be the man who will be the problem. One of the factors which a man may affect, they may get abnormalities, that you find the testes have not formed properly, or the testes are not descended, or they're not there. Or actually even the male organ is not well formed. So you can get malformation. Two, you can get actually where actually the sperms do not come out at all. There are no sperms. We normally say when people have sex and ejaculation occurs, 90% is fluid. So the fact that someone is able to have regular coitus and ejaculate does not mean there's sperms, because 90% is fluid. So you can get instances when there are no sperms at all. Somebody is born like that there are no sperms which are forming at all. Or the sperms are completely abnormal, because they must be normal. Or still, the sperms are not able to swim up. Because what happens when there is a natural sex, the sperms are deposited in the birth canal, and then they swim up into the womb to the fallopian tubes where the fertilization occurs. So there could be sperms that are abnormal, they're not able to swim, or they're completely abnormal, or they're very, very few. Two, men can get acquired problems. Like smoking can significantly affect fertility, because it will interfere with the blood vessels. People who work in a very warm environment, that's why the scrotum is outside, because you need subnormal temperatures for it to work properly. That may be a factor. Or you can have injury to the testes themselves, or torsion can occur. And you get that actually the sperms do not form at all. So that can happen progressively. Age is not an important factor, but there are other factors. Again, the other factors which we talk about, like the drugs people use, some of them can affect the quality of the sperms. Like actually the drugs like heroin and other drugs can affect actually the spermatogenesis, the formation of the sperms. So all those factors, and then of course drugs for cancer can affect some medication. When you come to the female, they can also get abnormalities in the reproductive system. In rare cases, you may find that somebody doesn't have the uterus, doesn't have the fallopian tubes, or the ovaries are not there. So what you call congenital anomalies. Then in the female, especially in the Africa setup, we get very, very, very high prevalence of uterine fibroids. Uterine fibroids can significantly interfere with one getting pregnant. There's also endometriosis, where you get retrograde, the periods go backward and they affect the ovaries. And then what you call adenomyosis is the lining gets attached to the womb. All those factors, and again, infection, pelvic inflammatory disease can affect the fallopian tubes, and the tubes are damaged and they get blocked. That's a significant factor which can occur. And then, of course, we have said age eventually can also be a factor. So all those factors, and those factors are more likely as one gets older. So very important for the society to understand that failure to conceive is not a woman thing or a man thing. It's actually a couple thing, and either can get affected. Very important. We have almost 10-20% both couples affected. They have a problem. Yeah, and therefore when the one is going for a consultation, it should be a couple, not one person going. Both of them have to go. You encourage both of them to visit the clinic. All right, and allow me to ask you this particular question, Doc. Like there are a lot of concerns, especially when it comes to getting treatment for this.
there are also misconceptions and myths about infertility, especially in an African setting, something to do with the curse, you know, and women always being blamed for this. Maybe you finish by saying it should be a couple's concern. Maybe you can explain why, you know, why must it be a couple concern, and how important it is that couples stick together and support one another during this time.
Why it's significantly important? Because when a couple fails to conceive, we don't know who has a problem. The problem can be either. There's no outside factors that we can be able to tell. If a couple presents and say that they can't have a child, you cannot be able to tell whether it's a man or whether this woman has a problem. You cannot be able to tell. Significantly important, it could be both of them. We've had cases where actually one person comes in, like a man has a problem, we think the lady doesn't have a problem, or vice versa. But it can be both of them, 10-20% will have a problem. And that's why it's so important that we cannot tell by physical or by history who has a problem. So it's important we test both of them, we see what the problem is. We've had cases where actually men come forward and they can't get children, and they divorce their wife and they marry another wife and another wife, and they can't get children because they have a problem. That's very, very important to understand. And very important again, because this problem can be addressed. Whether it is the male or the female, both of them can be addressed. That's why it is important. Yeah.
We'll talk about the treatment options, but here there are different types of infertility, primary, secondary. Maybe you can take us through that.
Primary infertility is where a couple has never had any pregnancy, be it a miscarriage, be it an ectopic, be it an, what you call a menopause. They have never achieved any pregnancy, or even a miscarriage, or even a stillbirth. They have never achieved pregnancy. But secondary is where pregnancy has occurred. It could have been a miscarriage, an ectopic pregnancy, or could have been a stillbirth, but they have had a pregnancy before. That's very important. Secondary infertility can even they have children, they have 1-2 children, but now they cannot conceive. So it's secondary because there's actually pregnancy has occurred and the child is there. So that's what we describe as primary and secondary. But that is all. We don't have any tertiary. That's primary and secondary. And then we can talk about female factor and male factors. Factors which a male will get involved and the female will get involved.
Okay. So, Doc, just take us through some of the, let's say, risk factors. I know you had mentioned them, but you can link this with maybe do we have the level, okay, we'll talk about the level of knowledge there is about infertility in the country, but the risk factors for infertility, maybe do we have predisposing factors? I know you had spoken about smoking, you had spoken about age, but do we have more for both?
Yeah. One of the risk factors is casual sex because of the risk of sexual transmitted disease, both in the male and the female. Because if there's casual sex, you can get gonorrhea and chlamydia. What gonorrhea will do, it will go to the fallopian tubes and it will damage them. That's where actually, you know, when normal fertilization occurs, when there's coitus, the sperms will swim up and the egg will come from the ovary and they'll meet in the fallopian tube. Fertilization, the coming together will occur, and then the pregnancy will occur in the womb. So the tubes can get damaged by those infections, such that the sperm and the egg will never meet. That does not, the same thing can happen to a man, that actually the tube which carries the sperm, called a vas, can also be damaged. Vas deferens can get damaged, blocked, and therefore one has pumps, but they cannot actually come out and be passed. So infection is a big problem in our setup, and that's why casual sex, because of the risk of gonorrhea, chlamydia, is a factor in itself. The other factor, what you have said, age, that will not explain it. We have them, but the other factor is as uterine fibroids is a major factor. That if one has uterine fibroids or endometriosis is a factor. For the ladies, if the periods are very, very regular, the ovulation is not occurring, the egg is not coming out. When the egg is coming out, the periods are very, very regular. They occur every month. So if one is getting every month, that's a sign of ovulation. If one is missing periods for 3-4 months, or sometimes getting 2 or 3 times in a month, that means ovulation, the egg is not coming out. That becomes a major risk factor. For the ladies, if there is abnormal hair growth, there could be polycystic ovarian syndrome. There could be the ovaries are producing slightly more male hormones. The ovaries will produce both female and male, but very minute amount of male hormones. So if you produce excessive, ovulation cannot occur, and that's why you'll get some ladies have a bit of hair. So if someone has excessive hair, like a beard or hair in the chest, then that's a very, very risk factor. Again, we don't want to get, lifestyle can be a major problem for both male and female. When obesity occurs, the BMI is very high, obesity, then both male and the female at a risk of not producing the sperms and the female not producing the eggs. So obesity again is becoming a big problem in the society, lifestyle disease. And of course, excess consumption, what you have said, the drugs, alcohol, if excessively again can affect, that's what we say the lifestyle can affect actually the production of the sperms and the production of the eggs at the same time. Yeah.
Okay. And can infertility be treated? What are the available options?
The most important thing is to identify what is the cause.
Yeah.
We need to know if it's a male, we need to look at the sperms, see whether they're abnormal or whether there are any abnormality in the sperms, whether they're able to swim up, whether they're able to fertilize the egg. So we normally look at the sperms themselves and identify. We may also look at the man himself and see whether there are a problem, because there are other factors which can contribute. Like you may find someone who doesn't have the testes are not descended, or they could be having other problems like thyroid disease, which can affect. In the male, again, we need to look at whether the tubes are blocked or not. We need to look at that. We do normally do an X-ray called hysterosalpingogram. We look at the signs whether ovulation is occurring. We look at the hormones. So the treatment can be simple sometimes. Is if the male, the lady is not able to, the egg is not coming out, we can put on fertility drugs. Then it should be to cause the eggs to come out. It's not a one-off treatment. It can take up to 6 months, but eventually they're going to conceive, especially when you have what you call polycystic ovarian syndrome, where the egg is not coming out. So one option, we put them on fertility drugs for the ladies. If the tubes are blocked, we can do surgery to unblock them. If it doesn't work at all, then it may require in vitro fertilization for the ladies. If the uterine fibroids are there, then we can remove the fibroids, and more often than not, you get the fertility will be able to occur. Again, there's what you call adenomyosis. We can be able to give you medication to suppress it, so the medical treatment. But ultimately, if the conception cannot occur completely in the lady, then we can be able to do in vitro fertilization. For the man, if there are no sperms at all, sometimes there's no medication we can use most of the time. If the tube is blocked, which carries the sperm, then you can do surgery. So if there are no sperms at all, we can do what you call sperm donation, and that is quite common. There are cases where a man can produce sperm, so we can get sperm from somebody else and be able actually to inseminate the lady. These sperms we screen for HIV, hepatitis, syphilis. We take the family history to make sure you don't pass any disease to the lady. So there's intrauterine insemination. You are actually inseminating using a donor sperm. Or in a man, if the sperm count is not very good, you can be able to concentrate it, then do artificial insemination by the husband at the same time. Yeah. In extreme cases, again, you can have in vitro fertilization, IVF, where actually we can be able to go to the testes, cut the testes a bit and suck. You get a scattered egg and be able to do what you call ICSI, get one egg and inject into the outside the body. So those are the treatment options that we normally have.
Yeah. And are there extreme cases where the infertility, maybe because of the level, it cannot be reversed for both male and
yes,
female?
it's true. Yeah. It's true. There are cases where you get a man that is not able to produce sperms at all, and is not. That's why we are saying that they require sperm donation.
Yeah.
Yeah, there are cases, and they're quite many nowadays. Yeah. That there are many men. I would say almost 10-15%.
Or
it could be natural.
Could be what you mentioned.
Yeah, it could be natural that actually someone was born like that, especially when the testes are not out, or sometimes you cannot identify the case, or could be the mother, the drugs they took in pregnancy can affect that. And then it could be something which is acquired. Like if the testes are hit, or there's what you call torsion, or some medication may really interfere with the testes, especially in the early age. So those can be the factors. The same applies to the lady. It can be something they're born with. They're not able to produce eggs at all. Or eventually the eggs get finished very early, what you call premature ovarian failure.
And for the female?
For the female, that's when you are saying that they can be born like that. That you find somebody, especially, and that's when it's very important for the girls, they must get their periods 12, 13s on average. If the periods don't come by 15, 16, it's a sign there could be a problem. And the problem could be actually the ovaries are not functioning properly, they're not forming properly. So we need to know that. So it can come naturally for the ladies, or it can be diseases like polycystic ovarian syndrome, which the eggs are there but they do not come out. Or sometimes the eggs can get finished, what you call premature ovarian failure with the ladies. Yeah.
Okay. And from the definition of infertility, you mentioned that if you are active for more than 12 months and nothing is happening, then that could be a problem. Is that when now a couple should alert their doctor?
Yeah, that is true. Yeah. If the couple stay together, they're having regular sex, then they should see a doctor if within 12 months they have not conceived. Again, the other factors we're having problem we never discussed is actually distance is becoming a problem. Somebody is working in Nairobi and the other one is working in Mombasa, and they meet once or twice in 3 months. That can be a factor that you have to know, that the chances of you conceiving becomes less. It's very important to understand when the egg comes out in the female, it is there in the body for about just 24 hours. So if the sex does not happen just before or when the egg is coming out, then pregnancy will not occur. So distance can be a problem. That actually sometimes we just advise people on how to have timed coitus, timed sex. That's one of the factors. Yeah.
And from the factors contributing to this, infertility can be prevented, right? How do we prevent it?
Yes and no. Some form of infertility can be prevented.
Yeah.
We have a lot of tubal blockage in this country. A lot of tubes. Almost the study which was done in Kenyatta shows that almost 60–70% of the ladies who are not able to conceive, the tubes which are blocked. And majority of them is because of gonorrhea, chlamydia, sexually transmitted disease. So if people avoid casual sex or use protection like condoms, then the risk of getting sexually transmitted disease becomes less. So the chance of them getting fertility becomes less. Because in the West, you find that actually pelvic inflammatory disease, the infection are much less because of the preventive measures or early treatment. So that can be treated to some extent. The other issue is because of the careers, people are going to school, they're getting their doctorate, they're delaying childbearing, age is becoming a factor. And you're saying people have to try and get a first baby before they're 35. So that you can be able to prevent fertility because one of the age, two, diseases like uterine fibroids become much commoner much later on. So advisable people should get children early, at least the first child before they're 35. Trying to get child in the 40s is a gamble, very, very serious gamble. And the chances of getting natural conception, if you have a problem beyond, when you get to the 40s, you get a 4, it becomes very difficult. So it can be prevented if you get children earlier. And if you look at the urban areas especially, the delay is much more in getting children. That is causing a lot of problems in the couples. Yeah.
And I'm told we need to wind up, but not before I ask you, because you've cited some, percentage of women struggling with fertility, maybe from your interaction with patients. How would you describe how big of a problem is infertility in Kenya? And of course, link that up with the level of awareness, because there is a lot of stigma when it comes to infertility. When a woman is infertile, then she will be divorced, and the couple will not, the marriage will not stay if there are no children, so to speak.
We don't have very clear data, but the data will range in Africa from about almost 15 to 30%. And I'll say that for every 10 couples you see, at least about 1 or 2 will have a problem. Or let me put it, for every 100 couples, about 15 to 20% will have a problem. Yeah. For every 10 you see, most likely 2 will have a problem. That's how significant the problem is. Or for every 5 people you see 1. But it's a very silent issue. People don't talk about it, so it is never, you never know. It is not like having a cancer where you actually people get to know their disease. So people are just quiet. Yeah. But it's a very serious problem. When you go to the gynecology clinic in Kenyatta National Hospital, the majority of the patients who go to the gynecological clinic is because of infertility. That's the biggest cause of consultation at Kenyatta National Hospital. Yeah. And
in 5 seconds, would you say what we need to do to address this?
Creating awareness and including this in our facilities. In this Kenya, and I've said very many times, we don't have public in vitro fertilization fertility. And we have fought for it in Kenyatta National Hospital. It has not happened. In Uganda they have one, in Ethiopia they have one, Zambia they have one, but we don't have a public in vitro fertilization. And this is my message to the people in the Ministry of Health. We need a public IVF center where it can treat the patients, to train also the doctor on in vitro fertilization. Myself, I'm trained in UK, it's very expensive. We need to train people on this, on infertility and how to prevent it and how to manage it.
Treatment and awareness. Dr. Wanyoike, thank you so much for being part of our conversation. I do appreciate it.
Welcome.
All right.
Thank you.
And that's all the time we had for the show tonight. Thank you so much for watching. Thank you for spending part of your Sunday with us. Do have yourself a lovely evening. I'm Purity Museo. Good night.